TopMedTalk.
Hello and welcome to TopMedTalk. I'm Desiree Chappell, and we're coming to you with coverage of the COVID crisis from the front lines. We've had fantastic conversations with care providers all over the globe who are either on the ground themselves taking care of patients or playing a more supportive role in this battle against coronavirus. Now, we're going to continue to share these stories in hopes to provide resources and support to all healthcare workers on the front lines caring for COVID patients. Now, today, I'm in Louisville, Kentucky, but I'm joined by our editor-in-chief in London, England, Monty Mythen. Hello, Monty. How are you doing?
I'm doing well today, Desiree. Obviously had a little bit of an emotional day yesterday for various different reasons that we shared, but I'm feeling well in myself today. And I just want to say thank you very much indeed for, even though it's close to, well, it's actually past some people's bedtime here in the UK. It's great to be included in this particular conversation because I'm excited to talk to one of our best global friends.
I know. Well, one of the awesome things about what we're doing is that we get to talk to people from all over the world, but the hardest part of our job is coordinating times where everybody's awake and functioning at the same time.
Can't we with COVID-19? Can't we? Why can't we just go into a single time? Anyway, moving on.
Moving on. Well, Monty, our next guest is an absolute favorite on TopMedTalk, a TopMedTalk superstar, frequent contributor, especially during the COVID crisis so far, Ross Kerridge from Newcastle, Australia. Ross!
Hi. And Monty's late at night and I'm early in the morning. So.
That's right.
Yeah, but we actually can see each other. This is, podcasting, but we're actually on a video platform. But you look well on it, Ross. I look, and Desiree looks well. I look tired.
Yeah. Well, we need to go to bed.
Soon enough. Well, I wanted to coordinate finally where we could have everybody on the same call, at least for just a little bit, to talk about some of the things, to really get an update from you, Ross. And then there's every time we have this conversations, I think we get into these great kind of scientific, clinical type conversations, but we also either have an existential conversation or maybe a bit of history. And so I wanted to make sure that we touch base with you again. So first of all, tell us a little bit about what's happening on the ground in Australia. So I know that when we talked to you last time, you had not seen any kind of major increase. What is it like there now?
Yeah, we've not just flattened the curve, it's turned right down. We had 8 cases diagnosed nationally yesterday. And in total, and now Australia's population is 25 million, so about 1/3 that of the UK. We've had 6,500 cases and 75 deaths in the last, 6 weeks. And it seems to be quietening right down. So, 4 weeks ago, we were all action stations, task forces, stopping all surgery and revamping the hospital. And it's amazing, and I know everybody across the country had the same experience. It's amazing how much things have changed and how all of a sudden things that were item 7 on the agenda for the last 5 years have just been dealt with. And a lot of people, indeed, if we could only do this all the time.
Rationalise that for me, because as I remember, you were over in the USA around the sort of point of probable contagion and then travelled back to Australia, probably, bringing, who knows, possibly bringing a few droplets back with you. How did you manage that? And we didn't manage that in either the USA or the UK.
Look, to be honest, I think, yes, we were lucky. We did stop travel from China and Italy very early on, I think before the end of January. And it was seen as a bit controversial and a bit of, some accusations that this is racist at the time, but people got through that. And in fact, it's been shown to be a good thing. And then certainly when I came back, I had to go into quarantine for 2 weeks. And then they made that more supervised than with me and really got strict about it.
Clarify that, Ross, when you say you had to go into quarantine, did they say, please, would you stay at home for 2 weeks and stay away from people? Or did they say, welcome to this hotel and we're going to lock the door?
No. I didn't get the hotel. That came in. It was, you have to be isolated at home. But it was legally sanctioned. But
it was legally sanctioned.
Yeah, and there was a Yeah, there are a couple of people locally who were fined for going out while they were under quarantine, but mostly it was voluntary at that stage. A few days later, it became mandatory and you got locked up in a hotel at the government's expense for 2 weeks. If you're lucky, you got a 5-star hotel, and if you weren't, you got the Ibis.
Other hotels are available.
They are.
Yeah.
Thanks, Monty. Disclaimer.
So, and then all travel is, virtually all travel has stopped. Exactly when we're going to be allowed to go overseas or indeed interstate, this stage is not clear.
Tell me, you guys have done all this major, social distancing, isolation, quarantining early on. You haven't seen the wave. Has there been anyone dissatisfied, or, is there a little bit of civil unrest with, we did all this, we haven't seen the cases? Because that's what we're hearing in the U.S. It's like they don't necessarily understand the science behind it. But then there's just this civil unrest of let me out of here kind of thing.
There's been some fairly muted voices at the sort of economics, academic level. In the community generally, no, it's been pretty well accepted thus far. How long that will continue, I'm not sure. But the big thing that's probably made that different is that really based on the lead in the UK, I suppose, the government brought in a much bigger social service, if you like, unemployment benefit for 6 months.
Okay.
It's $750 a week, which is, it's not a lot of money, but...
you can live off it, can you?
Yeah.
So, Ross, to cut to the quick here, can you surf Bondi, for example? Or is that a no-go? Is that exercise or is that a no-go?
I don't think that's a personal question to you, Ross.
Okay, I'll rephrase that. So Bondi Beach is the sort of, I'm sure there's much better surf beaches in Australia, but that's the sort of thing that almost everyone who knows Australia's heard of Bondi Beach, and a big surfing culture there, which is exercise, but it can occasionally result in getting close to each other. How do you manage that?
The beaches in Sydney were closed completely till, I think, Tuesday this week. You can now go onto them and swim for exercise, but in Newcastle, where I am, same thing. You can go out in pairs for exercise, but you have to keep on exercising. You can't stop. And famously, as Desiree...
I was just going to ask.
There was a chap in Newcastle, I got on national news, who was fined $1,500 because he went out and got a kebab and sat down to eat his kebab. Of course, it was 2:00 in the afternoon, so people didn't have much sympathy for him because you go out for a kebab at 2:00 in the morning, not...
Yeah. So what...
for the run.
What was he fined for, Ross? The choice of eating a kebab or for sitting down? I'm a kebab lover, by the way. But
okay.
Well, I think it was breaking...
Combination. It was combination. Just
going out without necessary purpose.
Yeah. So where are you guys, remind me again, getting ready to start elective cases again? How are you going to manage that?
Yeah, in the last week, it's been, and the National Cabinet on Tuesday said, we need to restart elective surgery cautiously. And the recommendation is at 1/4 of the level of activity before, and selected high-value, low-risk cases to proceed. IVF was one of the things that came up that's been causing a lot of emotional distress for those needing it. We're scratching our heads as how to do that, both logistically and organisationally, going through, in my hospital, going through the lists of cases and picking out appropriate ones to start with. But there is this issue now that we don't have widespread, we presume we don't have widespread herd immunity. And we've got to work out now, what does that mean? Do we leave the country locked up forever, or do we wait for a vaccine, if a vaccine for coronavirus is ever going to be developed? Do we just allow a slow burn? I think that's what's going to happen, a very, very slow, contained burn.
So what are you going to do about your elective cases? Because there are a couple of ways of looking at that. Don't test if you had an antibody test, etc., and therefore don't know, and let's see what happens next. Or test everyone. Even if you don't have a reliable antibody test, it might come along so you can take blood and learn from what happens next, because it's very hard to believe that you really ducked coronavirus completely. You might have just ducked the number of symptomatic individuals and the all those things that go with it. That's what we're all struggling with that now. We're all struggling with how do we reintroduce elective surgery safely, effectively and sensibly.
Yeah. In terms of testing, the rates of positives in the community where they've done random PCR samples on populations, it's well less than 1 in 1,000.
Yeah, very low. Yeah.
So there's no logic to doing PCR testing as a screening tool. That's not to say people won't advocate for it. The main idea is thinking that we should say to people booked for surgery that they have to go into 2 weeks strict self-isolation. That's not much of an ask at the moment because that's virtually what people are doing anyway. But in our instructions on phone calls and whatever, we're saying do it and really do it.
Quarantine, not isolation, is a difference.
Yeah.
Ross, the CDC has recently said for us that we're expecting a bump back in the fall whenever flu season starts again. Is that something that you guys are concerned about? Because you now are just going into flu season, yeah?
Well, we don't really know what's going to happen.
Yeah.
People are still trying to work out why we got lucky, and we're not sure what's going to happen as the social isolation rules will have to be relaxed within the next few weeks a little bit. They're sort of signalling that it'll go from meeting in pairs to meeting in 6 to 10. Not big sporting events, although one of the football codes is wanting to start football without any crowds so they can at least get the television.
I know a lot of people will be excited about that.
Yeah. Some sporting events aren't very well attended anyway. You can keep the crowd well under 50. But
Actually, the other thing that's come up this week is there's a proposal to get people voluntarily to install an app on their phone, which it doesn't track them, but it enables tracking contacts using Bluetooth. Looking at it, and I'm not a techie, but the tech advice that I've seen seems to be it's pretty good and that we should support it. And the AMA, the Australian Medical Association, is backing it. Although that hasn't been announced yet.
We could speculate. Do you think that you'll get backing for that app from the highest level, Ross, or do you think that's a known unknown at the moment?
Well, they say that you need 40% of the population to install it to make it a worthwhile exercise. That'll be interesting to see. I think the funny thing is the idea that how can you have privacy with this? And you can suggest, well, you can leave your phone at home. You don't have to carry your phone all the time, but that seems to be inconceivable.
That's like an appendage.
You cannot cope with the idea that you can do without your phone.
No. How'd you get back from your walk if you don't have your phone with you? How do you...
Yeah, totally. Tell us a little bit about the special time that's coming up here in Australia.
Yeah, okay. And the other thing, I've been writing a weekly piece for the local paper on the COVID thing. But
what's the local paper called again, Ross? We should give a big shout out to them. The global readership will rock it.
Yeah. The Newcastle Herald. So the context, you and everybody around the world has been picking up on this theme of the healthcare heroes. And many people are a bit embarrassed about that term and just saying, look, I'm doing my job. I'm not a hero. And I get that. But now tomorrow in Australia and New Zealand is ANZAC Day, which is based on when Australia and New Zealand first went to war together in World War I. But it's a very solemn day. It's a big day. It's sort of, in American terms, it's, if you like, a combination of Memorial Day and Thanksgiving. And the key part of it is the dawn service. And every community will have a dawn service, and our local dawn service gets about 30,000 people, and you gather at 4:30 in the morning, and if it's cold and raining, you can hear parents telling their kids, just be grateful we don't have bombs dropping on us and all this. But it's a time for solemn reflection, and there's some speeches and ceremony and playing the last post and a minute's silence and so on. So it is a day for reflection, and based on that, I shaped my piece around the heroes thing. But I went back and looked at, if you like, the quiet heroes, the nurses and doctors who served in World War I and World War II in this case, and just read up the stories of some of our local people, some of whom I knew personally. One of the doctors who had been a doctor on the Burma Railway, which was the railway built under appalling conditions from Thailand to Burma during World War II. And there were 43 doctors from Australia who were sent to support the soldiers who were there as prisoners of war, working as slaves on the Burma Railway, and what they went through, and thinking about that. And, you're pretty humbled by reading the stories and horrified as well. But I happened to be the last one. He lived to 102, which is an extraordinary thing. He was the last one in Australia to pass away. But I went to his 100th birthday dinner, and the Governor-General attended and made a very warm and inspiring commentary on this. And he commented that the normal courage and bravery of the battlefield that we hear about, you can win a Victoria Cross in a few minutes of craziness. That's our highest award for bravery. But he talked about the bravery of the prisoners of war, and particularly the doctors on the Burma Railway who had to put up with the conditions, who had to come up with extraordinary solutions to lack of equipment, lack of drugs, making their drugs in extraordinarily innovative ways, advocating for their patients, and sometimes getting beaten and tortured for excessively trying to defend their sick soldiers from being taken off to work on the railway again. And their bravery was just getting up each morning and keeping on going and going to work and maintaining the morale of the troops all around them. And it's not a glamorous, exciting bravery, but it's a very different order of bravery, and we need to honour that. And so I found the stories, and then the real kicker, can you believe this? One of them, Colonel Tom Hamilton, who was one of the senior soldiers on the Burma Railway, and he got to the point where the commandant had told him one day that towards the end of the war that they'd been instructed if the troops invaded, if the Allied troops invaded, all the prisoners were to be executed, but he would do him the honour of executing him himself. And Tom Hamilton sort of said, well, thanks, but I'll do it myself. And when they surrendered, the surrender was the commandant handed over his sword, because after the atomic bomb was dropped, they were told to surrender unconditionally. Anyway, his great-granddaughter has recently been appointed as one of our intensive care specialists. So,
wow,
nice,
great story.
Yeah.
So with that sort of heroism, hero status stuff, it is absolutely going on at the moment. That sort of silent, relentless, caring, and it's. I know it's not the trenches of the First World War, but if you go in and get close to it, it's really tough.
Yeah. Look, we haven't had to deal with anything like what you've had to deal with, and we're just horrified. And
I haven't, Ross. I ducked the bullet. I got sick at the right time, and then they worked out I was a bit older and all those good things. But I've been in close enough to see them working really hard at it, and it's really, really hard. It's physically and emotionally really hard.
Mm-hmm.
Yeah, and I think that's the comparison. Obviously they're under much worse conditions, but I thought, look, I know you might be embarrassed by taking on the term hero. And for someone, and particularly, forget about the doctors and the nurses, the cleaners, the orderlies,
absolutely,
clerks, who have to, get out of bed and go to work and, not getting the glamour and the big bucks that we get. But saying, no, this is something I've got to do my job.
It may for a second, because we've just started to look at our within hospital, death list, what the memorial will look like afterwards. And those are the people whose names are already sadly getting up there on the board for, it's not, we've been relatively protected in the very front line by having the PPE and kind of being able to spot the enemy. There you go.
Yeah.
Ross, thank you so much for sharing that with us. I think it's so important. And like you said, I know a lot of people are trying to steer away from that hero terminology or whatever, but they absolutely are. I mean, anyone that's had to go in and take care of this. And we just really want those people who are on the front lines to know how much, we appreciate you, appreciate what the work that they're doing. So
And we recognise that front line includes the bus drivers and the
absolutely.
people driving
anybody
the
that still has to go to work right now.
Exactly, that makes it happen.
Yeah. Dietary and nutritionists and pharmacists and everybody.
Everything,
Yeah. And the whole community. And in Australia, they've been heroes just by following the social distancing rules.
Absolutely.
Yeah, we all actually can do our part on this one. And it's,
By the way, Ross, EdPom London is absolutely on. We've decided to cancel none of our meetings. We just recognise the fact that you might be running your version of it from right where you are at the moment.
On the beach.
And mixed. So we'll make it happen. We're working now to how to make that happen, including the legendary, I was going to call it a pub crawl, but it had a more devious name for pretending it wasn't.
Cultural orientation.
There we go, cultural orientation. So we'll get the camera crews out and we'll pick the venues. We are working really, really hard on the alternative ways of delivering our global experience together, cultural experience. We're going to get
I think it can actually. It might be more. It might be more exciting at this point because we get to hit a lot more different points and get out of the country a little bit.
Yeah, and
we'll make it work.
Yep.
We're going to play a little song as we go out here. So tell us about that.
Well, it's not a song, but I was talking about the dawn service, which is tomorrow morning. It's April 25th. So tomorrow, normally we would be in the big crowd, but in fact, because of social distancing, what's happening is that the idea is that there's going to be a broadcast at 5 o'clock in the morning from Canberra, on national radio. You just stand on your balcony or in your driveway with a candle as families. And so we're doing a dawn service with social distancing. But the most solemn part of the dawn service is where they get to the Ode of Remembrance, and essentially they play the last post, and then there's a minute's silence, and then a recitation of the Ode, which I'll say in a second, and then Reveille, which is a bugle tune, and then we close the service. They shall grow not old, as we that are left grow old. Age shall not weary them, nor the years condemn. At the going down of the sun, and in the morning, we will remember them. We will remember them, lest we forget.
TopMedTalk.
It's Desiree Chappell here. Just a quick reminder, subscribe to TopMedTalk. We're a daily source of news and conversation focused on perioperative care. We can also be found on Twitter, Facebook, LinkedIn, Instagram, and we now have a free mailing list with special offers and additional goodies for subscribers. Go check us out at TopMedTalk.com. That's www.topmedtalk.com.
TopMedTalk is proud to thank its sponsors, specifically Edwards Life Sciences, for their generous support through this global crisis.